This is the area where my brother died. He was smoking crack. He smoked it and then just was found like an hour later.
Collie Sedgemore's brother died from contaminated drugs. And ever since, Collie has been working to stop the overdose crisis. This is how personal the fight is for you.
Yeah, well, it's not just my brother, it's also the other people that I've lost too. It's the amount of loss that we're dealing with in this crisis. And it just seems to be getting worse.
Here in BC, almost 7 people a day die of overdose. That's almost 10,000 people in the last 6 years. So the government here is about to try something that's never been tried across the country. They're going to decriminalize small amounts of some illicit drugs, like heroin, like cocaine. I'm here in Vancouver to find out if decriminalization will help stop the crisis. Collie works in this overdose prevention van, where they give out clean supplies and keep an eye on people as they use drugs.
We save lives. People are able to smoke safely, and we can watch them and make sure that if they overdose, we can reverse it.
Collie tells me there's another reason the work they do here in the van matters.
Yeah, well, as a drug user myself, it's kind of just like showing people that people can be functional addicts. It's really important to me.
Collie has been using drugs for more than 10 years. That's why I want to know what he thinks about decriminalization.
It's a step in the right direction, but it's also really flawed because they think it's going to help overdoses. It's going to help curb the overdoses when it's not. It's all this does is just limit people getting arrested for using drugs and stuff. People are still going to be dying from toxic drug supply.
Most drug overdoses happen because street drugs are contaminated with things like fentanyl, and so users don't know exactly what they're taking or how strong it is. Why do you think the government's doing this?
It's just another way for the government to pat themselves in the back and say they did something when it's not.
What Collie wants the government to focus on is getting rid of the poison street drugs that are killing people. I'm going to be speaking with the Minister of Mental Health and Addictions. Is there a question you want to ask her?
I'll ask her how she'd feel if it was her kid. If it was her own child that was dying, died from an overdose and stuff like that. How would she feel? What would she do to fight this?
With Collie's question, I go see BC's Minister of Mental Health and Addictions, Jennifer Whiteside.
Hello.
Hi.
Hi.
I'm
Jennifer
Nick.
Whiteside. Hi, Nick.
Nice to meet you.
How are you?
I spoke to one user in Vancouver who lost a brother. I said I was going to speak with you. And he said, would you ask the minister if she would fight harder if this was personal, if one of these deaths happened in her family?
Well, I would say that that I think this is a personal issue for very many British Columbians, and our government understands that. And the work that we're doing is very much about responding to the proposition that I start from, which is that every single life is valued. 7 people a day are dying in British Columbia of overdose. How will your decriminalization plan help stop that or help that? So it's intended to ensure that we're not treating individuals who are using drugs, who are using small amounts, who are carrying small amounts for personal use, to ensure that they don't wind up on a criminal justice track, that they have the opportunity to use the drug that they've procured for their personal use, which is what they need to help get them through their day.
Do you think come February 1st, when you can have decriminalized 2.5 grams of heroin or cocaine, do you think that'll save lives?
I think we'll see. I think obviously we're gonna see the impact in terms of the interaction between what happens between law enforcement and individuals on the ground, and I think we'll see what happens.
But you're not going to say yes or no, because you want to see the data.
I am going to wait to see. I am going to wait to see what the data tells us.
The minister is hopeful that the new policy will work. But what about the people most affected by it? I'm at a meeting of the Vancouver Network of Drug Users. This is a group of users that defend the rights of people who use drugs.
Well, we've been fighting for decriminalization of drug users for as long as we've been an organization, for 25 years.
This group actually had a seat at the table as the BC government developed this decriminalization plan. They didn't want a limit of 2.5 grams because they say most users consume more than that in a day.
2.5 does decriminalize some of us. Not most of us, not enough of us, but we got our foot in the door. What do you do when you get your foot in the door? We all, because there's so many of us, we're an organization of 3,000 people, we all put our hands on that door and we pull the MFer open more.
I see the frustration here. They want change now.
You know, what's it like to live in a time where 7 people in British Columbia every day are dying of drug overdoses?
We've seen our community leave the planet. Half of it's gone, probably more than that. This building is surrounded by ghosts. All of our lives, we're all haunted by the ghosts of people who are gone. Just in December, around Christmas, Ricky, Flora, Miles, people we all know and have worked for years, gone. Never see them again. Will decriminalization stop that? No.
I think that it's not only about decrim, it's about getting a safe supply. You know, because, I mean, they could say you can carry 1,000 pounds, but if it's bad dope, we're still dead.
Does it mean anything that on February 1st you can go outside, you have 2.5 grams of heroin or whatever the drug is in your hand and you're not a criminal? Like practically or psychologically, does that do anything?
We got to stop the stigma of that all drug users are criminals. Like, oh, you use drugs, we don't want to talk to you, right? You know what I mean? That's got to stop. Okay, because there's real people who use drugs every single day and function every single day, you know what I mean? And you don't know it.
Yeah. For Colley, there are also practical concerns with the new law. As the decriminalization day gets closer, Colley worries that some people won't understand it.
Just so people understand that it's only 2.5 grams that people can have, or less than 2.5 grams. And it's just a way to show people in an easy, simple layout that people can read and hold on to.
Colley hopes the cards will help people understand what they can and can't do so that they won't be considered criminals anymore. But when the law takes effect, BC will still be in a crisis, 6 years into it. Here, even a family medicine clinic doubles as an overdose prevention site.
I've intervened in more than 100 overdoses, right on the doorsteps of our clinic. We had to get 2 oxygen tanks at our clinic for when there's 2 overdoses at the same time.
Dr. Christy Sutherland tells me things have been getting worse. Does she think decriminalization will make a difference?
What do you think about the government's decriminalization plan?
Well, I'm very excited about it because to me, it's like a change in the tide. It means that we can envision a better future where people who use drugs are not criminalized and punished for what they do with their own body, and that we can envision a future where organized crime doesn't have this billion-dollar, tax-free, regulation-free playground to sell to. I hope that we end up with a legal regulated market for all drugs.
But if that's to happen, Dr. Sutherland believes what we need is a more open discussion about drugs.
All drugs carry risk. Alcohol causes dementia and cancer. Cocaine can cause strokes and kidney failure. But it's not the risk that makes things legal or illegal, because what causes the most death? Tobacco and alcohol. What causes the most sick days and economic loss? Tobacco and alcohol. That they are the most harmful drugs because they directly cause cancer. Opioids don't directly cause cancer. They cause low testosterone and bone mineral density loss. So if we were to pick the thing to be illegal versus legal based on drug profile safety, we'd pick opiates to be legal and we'd make tobacco and alcohol illegal.
For Dr. Sutherland, if we're not honest about how drugs really affect us, how can we make decisions about them? As I walk down the street, I'm reminded that every time Colley and any other user buys drugs, there's danger. You can't know for sure what's in them.
When you look to the future, what do you see?
It's hard to hope for the future when we don't really know what's going to happen tomorrow. Like I could end up, for myself, I could end up dying tomorrow. It's quite heartbreaking, but it's also, it keeps me motivated to keep fighting. I see that no one else is coming for us. No one else is going to help us. It's like we need to help each other.
Nick Purdon, CBC News, Vancouver.